Hey, Margie here. Did you know that mold can be a root cause of osteoporosis and other inflammatory conditions? There's good news here because once we know this might be a cause, there's so much that can be done. And this is what we're going to talk about today with our very special guest, Jenny Johnson. And Jenny is a licensed physical therapist, a board-certified functional medicine health coach, and CIRS coach and consultant. And what that stands for is Chronic Inflammatory Response Syndrome. And that's something we're going to discuss today. And she's had over 25 years of clinical experience. And she specializes in equipping and empowering individuals to take control of their health and to cultivate the conditions for true thriving in mind, body, and spirit. She's the founder of Simplified Wellness Designs, LLC, where she serves current clients as a coach, consultant, patient educator, and community facilitator. And in today's talk, she really discusses what can happen with mold and what is this CIRS condition that affects over 25% of people. And the best part is what can be done about it. So there's so much great information. Stay tuned. Welcome, Jenny. I'm so happy to have you here on the podcast.
Thank you so much, Margie. It's great to be here.
You know, it's so interesting because I just recently had a minor flood in my house. Not a big deal, but enough that all my cabinets have to be removed. And they said, if you don't do something immediately, it was both in my kitchen and in my basement, there's going to be mold exposure and that can be dangerous. And so immediately we had to do remediation and get things started. But this is common, and especially there's just so many floods, so many things going on with our climate change. It isn't uncommon. And so I'm really excited we're going to discuss mold because it's definitely a root cause of osteoporosis. And a lot of people aren't aware of it. So I'm excited because I think we can enlighten people to something they can do something about. So happy to be you here.
Well, likewise, I'm happy to be here. And I'm so sorry to hear about the water damage that you had. I think most of us have an experience like that. I think it would be the rare person to say, I've never had a leak or a flood or something. Like it's part of living in a home these days on Earth. But if you're like me, you would have that thing happen and think, oh, no big deal. I'll get around to fixing it. And, whatever, like this is just part of, owning a home. Wouldn't really think about the negative impacts potentially of either letting it sit too long or maybe not cleaning it up in a certain way. Or if you have health issues weeks or months later, even potentially linking it back and maybe doing some testing to figure out, could this be related so that things can get fixed properly? So that's where I become passionate about helping people understand, because our family made the same mistakes too. And we got sick from exposures that we had no idea were a big deal.
Actually, you know what? I always love to talk about the backstory. And you, like me, you're a physical therapist. Yeah. Well, maybe share a little bit, the brief version of how, as a physical therapist, and you're working, I think, in pediatrics, how you came to now be, work with mold and the work that you're currently doing. You want to just share that story a little bit?
Yeah, I would love to. It's an interesting story. I think stories are interesting, but I'll try to spare you guys too many of the details because there's the long version, and I'll try to give you the shorter version. But my family and I, we had two little kids at the time. They were 3 and 5. We were living in the suburbs of Denver. I was working full time as a physical therapist in the school system. My husband, he was working full time in business, and we were both super busy. We decided to press pause on normal life and see if we could buy some land somewhere affordable, renovate the land, live off the land, and basically have a sustainable homestead. And this was kind of almost like a midlife crisis, but early on. We were still in our 30s. So we found a parcel of land in North Georgia to move to and to start renovating. So we built this whole organic farmstead out of the land. There were ticks. There was algae in the pond. There was bacteria and mold everywhere in our compost bins and in our chicken coop and in the feed, that we're feeding to the chickens. We had no idea that nature and living on a homestead involves a lot of, natural stuff that can make some people sick. We were also living in a little renovated cabin that came with the land. And we thought it was kind of cute to just live in this little rickety cabin with our little kids. And we were homeschooling. And we would put buckets under the leaks, just like, oh, we're living in the country now. And you just put buckets under the leaks. That's what people do, right? And we would do tick checks every night. And like, oh, look, we have these little critters on us. We live in the woods. We have bugs. Pull the ticks off. Well, we started to drop like flies as far as our health goes. And it started with my husband, who got acute Lyme disease from the tick bites. And he ended up, his acute situation turned chronic. He was on disability, bedbound. Meanwhile, I was working part-time as a physical therapist in the local school system and homeschooling my kids and running the whole like little farm that we were facilitating. And it was too much for me. So I put my kids in this little kind of school program that was held in the basement of an old church. And it turns out this old church had had a ton of water damage. They were undergoing renovations and remediations while they were letting our kids meet there for free, which is why we chose it, because it was a free space for our kids to meet and do this little homeschool tutorial. My son came home on the very first day that we sent him to the school complaining of symptoms that sounded just like my husband's, who was lying in bed with Lyme disease, except his started on the first day of school in this really sketchy building. Long story short, we learned that our family carries genetics for something called Chronic Inflammatory Response Syndrome, which basically starts with an inability to recognize biotoxins like mold toxins, Lyme toxins, bacterial toxins, things that can be in a water damaged building or from a tick bite. Our body doesn't recognize them as foreign. So our adaptive immune system, the part that makes antibodies, doesn't work. It doesn't make an antibody. And so the toxins, like the mycotoxins or the bacterial toxins, stay in our body and they just keep recirculating. What happens is our innate immune system, the part that just pumps out inflammation when there's like a bad guy, that's on high alert. That recognizes the toxin and just doesn't know what else to do other than continuing to pump out inflammation. That chronic inflammation turns into brain fog, joint pain, gut issues, all kinds of things. So my husband was going through this from a tick bite. My son ended up developing CIRS from mold exposure at the school. Little did we know our home was really not a whole lot better than the school. And so I think the stress of the situation of taking care of my husband, taking care of my son who I had to pull out, that tipped my gene into the on position, because it's one of those kind of epigenetically influenced genes, which can be either kind of upregulated or downregulated. So it upregulated my gene. Now all of a sudden, I'm not tolerating the house that I'm living in with the little buckets under the drips and the leaky windows and everything. So I developed chronic fatigue and fibromyalgia and insomnia, suicidal ideation, all kinds of weird symptoms, a little bit different than my husband's and son's, but still pretty scary. Again, long story short, we found a clinician. We found a website that explained what we had. We found that there were lab tests where we could confirm this, and there was actually a treatment. It did involve moving out of our leaky. We had to move out of our home, not just because it was leaky. You can fix any home. So I don't want people listening to think, oh, if I have a flood or a leak, does that mean I have to move? No, you need to fix it properly. But we were living in a biotoxin haven. So we had this little moldy, leaky cabin where there was algae in the pond. Blue-green algae can create biotoxins that are similar. Blue-green algae all over our pond. Ticks all in the pasture full of these biotoxins. We had this giant compost bin that we would turn with pitchforks. Bacteria, mold just interface, the chicken coop, just the whole lifestyle was not really conducive to our genetics. So we moved back to the suburbs. That was almost 10 years ago now. We are all fully well, but I become so passionate in all that I learned. And a lot of it we learned the hard way. There was some collateral damage in making mistakes along the way. So I'm now passionate about helping others who are at that point of, I have a leak. Hey, do it this way, get someone to fix it up this way. And if you start to feel any weird symptoms in a week or in a month, run these tests. And if they say X, Y, and Z, here are some doctors who can help reel it in, before it becomes a chronic condition, like, what impacted our family. So that's really what my passion has become. I'm no longer working as a physical therapist, Margie. So now that this gene has been primed and I have experienced this chronic inflammatory condition, I don't want to go into babies' homes and schools anymore. That I would always get so tired on the days that I would go to work. I would come home and have to climb in bed. And I thought it was because work was just so exhausting. Like, oh gosh, I guess it just takes a lot out of me. But I think I was getting low dose chronic exposure in all of the homes and flat roof buildings that I was going into as a pediatric PT. So I've opted to hang up my clinical hat. You can't ever take the PT out of a person. You know that. It'll always be part of my DNA, and I'm maintaining, my licensure. Maybe one day I'll find a way to go back in a different way. But for now, I'm really supporting people with mold exposure and water damage and preventing and treating CIRS. So sorry for the long answer to your sweet question there. I hope that wasn't too much.
I think it's so important that we understand why you're so passionate. So I appreciate you telling them. What a story. I mean, here you are thinking you're going to live in nature and do all these wonderful healthy things, and just the opposite happened. So how totally ironic is that?
Nature fought back. Nature wins. Nature's strong.
So
yeah.
The whole audience who's very interested in bone health and osteoporosis. So why don't you share why we're talking about mold and why mold exposure can be a contributing root cause factor for osteopenia and osteoporosis? Because what I see is it's very low on the totem pole. There's so many other things people are evaluating for.
Sure.
And often this isn't even realized. But why is this so important that we make sure we don't miss this?
Yeah, I'm so glad you asked that. I didn't even know the connection until pretty recently. I turned 50 and started, going through my own changes and checking hormones and doing hormone replacement stuff and doing my first DEXA as a baseline. And I will tell you, Margie, my bone health was nowhere near what I expected it to be, given that I've been active all my life. I eat well. I don't have the typical risk factors. But when I saw my DEXA scan results and then I started digging into what could be contributing factors to this that I'm not seeing, and I saw inflammation, I did not know that. I didn't learn that in physical therapy school. I don't know if you did. I know you're in the osteoporosis field. You probably have known that for decades. I didn't. And so and people who treat, the doctors who are treating chronic inflammatory response syndrome are not really linking it to osteoporosis either. They're talking more about the acute presentation of the mold exposure. But yeah, let me explain a little bit about how mold can impact our bone health. For one, we have mycotoxins. So mycotoxins are basically natural chemicals that are emitted by mold spores when they feel threatened. So it's their defense mechanism. I kind of tell people it's sort of like how a skunk sprays when it feels threatened. Mold spores emit mycotoxins when they're being encroached upon by maybe bacteria on some water damage. They're fighting for territory on a wet wall. Or if you spray bleach at mold spores and they don't want to die, they might emit mycotoxins. But when we're in a water damaged building and mold is growing, even if it's invisible, there are likely some mycotoxins. When we breathe those toxins in, or if we ingest them in our food. So mycotoxins can be on, coffee, tea, dried fruit, grains, nuts, chocolate, wine, pretty much everything good. No, we're not supposed to eat a lot of that stuff, but anything that started out moist, like a seed or a nut or a berry, and then had to go through a drying process before it was roasted or ground, into its final end product. If it took longer than 2 days for it to dry out, it probably grew a little mold. And then it eventually got roasted and turned into a flower or whatever, a tea leaf. But there could be some mold toxins, that are on those foods. So if we ingest some food that might have some invisible mycotoxins, or we breathe in these mycotoxins from a water damaged building, it can cause, what it can do is it can lead to intestinal permeability. So it aggravates our gut lining. Toxins directly it's like poking holes in our gut. And so we know that leaky gut or intestinal permeability can then be a root cause for chronic inflammation. I now know, you've known for a long time that osteoporosis can be driven by inflammation. That inflammation favors bone resorption over bone growth, kind of disrupts that homeostasis of the osteoblasts and osteoclasts balancing each other out. It's going to favor the resorption or the osteoclast activity, right? So mycotoxins directly can do that. And then on top of the activity of mycotoxins impacting our bone health, then we have the chronic inflammatory response syndrome condition that I was explaining, that about 25% of the population are genetically susceptible to. So we have the direct action of the toxins on our bones. And then we have the chronic inflammation that a lot of us have on top of these toxins staying in our body. Our immune system just keeps pumping out inflammation. And that is another, I guess, disruptor of the balance of I guess the bone dynamics, the resorption and bone development balance that we really want to have. Does that make sense?
Yes, no, that makes total sense, because that's what we're looking for. If we have the osteoclasts, which are breaking down bone, if the inflammation is increasing osteoclast activity, and what's so good now is we can measure that with our bone turnover markers. So if that's happening, a lot of times people, oh my gosh, I got my CTX results and it's really high. There's so much activity in these osteoclasts and they don't know why. So this certainly could be a reason. So I have a question for you then. How do people know if they have the CIRS, as you call it?
Yeah, good question.
And how is, you said you were 25%. That's a huge number. I couldn't believe when you told me that.
Yeah, so 25% have the genetic susceptibility.
Yeah.
And I think the EPA estimates that about 50% of buildings are water damaged. So if a quarter of us are walking around susceptible to this, and 1 in 4 buildings are going to be bad for us, it's only a matter of time, that we end up with this condition that can be difficult to reverse, once it is ensued. So, so there's a screening tool that only costs $15. And I love sharing. I think every allied health professional, everybody just should know about this, just to screen and rule it in or rule it out. But there's a website, survivingmold.com. And if you go on that website and type in VCS test, or actually VCS, I think that's it, visual contrast sensitivity is what it is. And you pay $15 to take their VCS test online. It takes about 15 minutes. And interestingly, this chronic inflammation that ensues if we do in fact have CIRS impacts our optic nerve and impacts our ability to decipher visual discrimination. So it's not so much acuity, like can I tell that letter is an E versus an F? It's more like, is there a shading there? It could be difficult to go up and down steps at night or something, kind of telling where is the edge of the step. It's more of like a visual discrimination of shadows. And so this VCS test, this visual contrast sensitivity test, is a screen of that. And the one that's on Surviving Mold has been, not thinking of the word right now, it's been designed to pick up kind of a classic pattern that CIRS people have. And so if you fail their version of the test in either eye, it is highly suggestive. I want to say it's 92% diagnostic for CIRS just in that. If you really try your best and you follow the instructions to set up your computer at 18 inches and you wear your corrective lenses if you wear glasses and you have your lighting just right. If you fail it in either eye, that's 92% accurate for CIRS. Then they're going to ask you a bunch of questions about exposures. Have you ever lived in a house with water damage? Have you ever been bit by a tick? It's going to ask you about symptoms. Do you have fatigue not explained by another condition? Do you have body pain? Do you have numbness, tingling, diarrhea? Metallic taste in your mouth, dizziness, ice pick pains, anxiety. It'll go through the whole list of the classic symptoms. And depending on how many you have, then that's another factor. Depending on how many you have, it's going to say, okay, now you're up to the 98.5% chance that you have CIRS. So you need to be honest when you answer the symptom, checklist. And if you have numbness and tingling, but you also have diabetes, you would not check it for that. Like if there's another known condition. But if you have gut issues and you don't really know why, or if you have fatigue and it's just been labeled chronic fatigue, if you have body pain and it's been labeled fibromyalgia, that's not really a reason. That's just a Latin name for body pain, So you would mark those symptoms on there. And if you have enough symptoms, which they will tell you on the screening tool, and if you fail that vision test in either eye, then it's suggested to get in with a doctor or do some of the labs. And some of the labs are available even direct to patient. Like if somebody doesn't want to get in with a CIRS specialist just yet, which can be kind of costly, there are some labs that they can do, with their PCP, if the PCP is open to it, or even direct to patient on Hip Evo or Life Extension. There are some direct to patient labs. They're all explained on the website, survivingmold.com, which labs to get and what the reference ranges are that we're looking for. That's what our family did. We got our PCP to order some of these labs, and they were all way off the charts. And that's when we knew we needed to get into somebody who really specialized in this and who could really do additional diagnostic workups and then guide our treatment.
So I have one question before we get into treatment, because I think the exciting thing, everybody listening, like, oh no, is that there's so much that can be done. Look at you, right? That's the exciting part. So I have two questions. Number one is, you said also people are genetically predisposed. So someone who's genetically predisposed, but they haven't had any exposure, will they test fine on the test that you're talking about with the eyes?
Yeah, so that's a really good question. So you can be born with the gene, and you're either born with it or without it. And there are a variety of these genes that can predispose. But then that gene needs to be primed or turned on by something. So when we're born, and maybe the first few years of life, maybe even through childhood, that gene is in the down position or in the off position, and we are detoxing mold toxins just like everybody else. And we can walk into a moldy building, maybe it smells bad, maybe we get burning eyes and a runny nose, but we leave and we're fine. Our body can handle that and detox the toxins normally. But something happens in life to most of us that turns that gene on. It can be a really bad exposure that can do it, or it can be another inflammatory event. So getting COVID could turn it on. Another, Epstein-Barr virus, a lot of the viral infections can turn, are inflammatory enough that they can turn on that gene. Trauma, so whether it's emotional trauma or physical trauma, like a concussion, TBI, that can turn it on. For some people, even just like surgeries, pregnancy, car accident, I think I mentioned that, just anything that kind of dysregulates your homeostasis and how you respond to that event can be enough to upregulate that gene. And now you might not tolerate the very house that you'd already been living in ever since you had that surgery, or you got COVID, or you had that car accident. Now you are not recovering. It may be that your CIRS gene has been primed and you are now assimilating toxins that you can't get rid of on your own.
Got it. So who would you say is, people are listening, like who's most at risk now for developing this? How would someone know? What are the people are listening and they're thinking, oh, maybe, I don't know why I'm losing bone. And, what are the, what are clues that could maybe tip them?
So there's not really like I guess a sign on the outside that we have this gene. It's not like all tall, brunettes have this gene or something. It's, you wouldn't really know. Although there is long, leany, hypermobile people tend to carry the gene that I have. And we are, we have what's considered the multi-susceptible or the dreaded gene for CIRS. So there is that, the long, lean, hypermobile folks. But I think for most people, they would have to just test their genetics. And there's a cheek swab kit that you can do on lifeextension.com. It's called the HLA-DR, a mold genetic test kit or something. And you'll find out if you have one of these susceptible genes or not. So some people might start there and find out, do I even have this gene or not? The thing is, people who don't have the gene can still get CIRS if the exposure is bad enough. And so just because you don't have the gene doesn't mean that you're not being impacted by mold. I think probably what's a simpler process for somebody who's kind of wondering, could this be part of my picture, is to do that screen, do the vision test, maybe check on your symptoms. If you want to do your genetic test, you can. It's about $250 though. You can also sample your home. And there's a dust kit that you can buy yourself and do a DIY dust sample of your home to see what's the biome of my home, and is it normal? Is it elevated? What's going on in my home? What am I being exposed to, or work or school or whatever? And so that could be another.
That you recommend? Is there a certain test that you like for the home?
Yeah, there's one called the Environmental Relative Moldiness Index, ERMI. We call it the ERMI. And it's not the score where it's been determined that the scoring system is a little bit funky. But if you look at the raw counts of the different molds that are on there, you can kind of see, they'll give you a star of like 10 times or 100 times or 1,000 times higher than normal. And then you can even Google, like, is this one that produces mycotoxins or not? And you can pretty much tell, like, when you see your presentation, like, wow, I have a lot of stars, or I have a lot of red, they'll usually use colors. That's one of the things that I consult on, is I help people understand their ERMI if they're not really sure what it means. But that's a good screening on your home, kind of like the vision test and the symptom assessment is a good screening on the body. We can screen our home. And then if we put them together, okay, I failed the vision test. I have some of these symptoms. Maybe we even do the genetic test. I got the genetics, did the dust test. I got a lot of stars. Yeah, you might be barking up the right tree. And while that's kind of bad news, it's also kind of good news. It's good news to find something that's treatable, that can maybe reverse or prevent acceleration of your bone loss, right? So maybe can impact your osteoporosis, but maybe things that you didn't even realize were due to this mold exposure. Maybe it's, body pain, gut issues, mental health issues, joint problems, dementia. This is a treatable form of dementia. So it can be kind of exciting when we realize, oh my goodness, we might just need to clean up our house and take a binder to pull these toxins out. And my brain actually is working better. And, my whole body feels better. I have more energy. So it's exciting too when we realize we can get a lot of life back.
Hey, Margie here. I just want to let you know that you can find my favorite items that make great gifts, as well as being good for your own health, on my website at margiebissinger.com. Just go to the top and hit the Margie's Favorites tab. And there you'll see the essential oils that I love for $15. That includes shipping. You'll see blue, black, and glasses. I wear these every day if I'm watching television or on any of my devices after 8 o'clock at night. This significantly helps my sleep. And there's so many more items. So make sure to check out these products that I personally use and love. So let's go back to the show. So now the question I have is, okay, you've done all these steps.
Yeah.
Do you at that point do a mycotoxin test on yourself so you know what you're dealing with?
You could, and there are some doctors who like to use the urine mycotoxin test or blood antibody test to mycotoxins. For those with CIRS, though, remember, we don't mount a proper antibody response, and that's the problem. And so we could have a false negative if we're looking at blood antibodies to mycotoxins. And then the issue with urine mycotoxin testing, well, it can be helpful if we get lucky and we take the test, on a day that happens to show a lot. It also can be difficult to interpret. We can acquire mycotoxins, like I said, from our food. And so if we pee out a lot of mycotoxins after we had some moldy peanut butter or a glass of wine, then we don't know, well, is this just a transitory thing because I just had a peanut butter sandwich? Or do I have something like CIRS? And so it doesn't really tell us what the source was and whether it's chronic or acute, that little mycotoxin exposure. So what I think is better is looking upstream, actually really downstream, at how is the body responding. And so there is a classic kind of fingerprint of inflammatory markers and hormones, and even a brain MRI that shifts. Like, we can tell what somebody's brain looks like if they've had mold exposure. And so there are more, I think, objective tests to look at the body and look for that classic fingerprint of your body is having an abnormal response to the mold rather than it was just exposed and it peed it out the way that it was supposed to.
How interesting, because sometimes people, okay, the doctor did the mold, the mycotoxins test, I'm okay. So what about any of the markers for inflammation? The like homocysteine or anything there that in the regular blood work might tip us off that there might be an issue? Is there any of those? Because all of us get the
I
CBC, we're
know.
getting the right. Is there anything in there? These are all special tests.
Usually not, which is really kind of weird because it is a chronic inflammatory disease. But usually, like our HSCRP is normal, or homocysteine may or may not be impacted. That could be a factor, but it's other inflammatory cytokines that are lesser known, like TGF beta 1, transforming growth factor beta 1 is a big one. We can have C4A and C3A complement factors that are elevated. And then P9, matrix metalloproteinase 9, is another inflammatory protein or inflammatory molecule that is often elevated that aren't routine. And so again, these are kind of classic, and Dr. Shoemaker has determined that in the general population, these are not elevated, but in people with CIRS, these funny cytokines are. And so there's a handful of labs, we call them the CIRS labs or the Shoemaker labs, that don't just look for the presence of mycotoxins, which could be neither here nor there, but is your body sick from them? So do you have dysregulated hormones and cytokines that are really unique as a kind of a picture or a fingerprint to somebody who is stuck in this chronic inflammatory presentation from or biotoxin exposure?
So I think the exciting part is that when you deal with this, then everything can get better. And so many of this things you didn't even realize were from this, and including bones, which is so nice. Who could think that this could be one of the root causes that you've just totally missed? And but it wouldn't show up on the regular testing. That's what's very interesting. So someone really does need to work with someone who has this experience and has this background, and they can do those basic tests that you mentioned, which I think are great. So at least to see screening tests that are very inexpensive.
Yeah.
So, but what happens then with, what have you, tell us a little bit about the treatment and like, all right, so now someone finds out, is it 10 years? What is the basic? I know every single person is different, and, there's not one size fits all with anything, but just give us some general, what happens at the person that, oh gosh, wow, I'm losing bone, and let me get these tested, and everything tests, yes, check. Oh my God, this could be this could be me. So now what does that person? That person worked with you or works with a practitioner who does have the background and the knowledge and this, and has this education. What happens then?
Yeah, what does that look like? Well, first of all, I want to agree it is worth it. That if you are experiencing bone loss and you're trying to do all of the things to reverse or prevent or slow that down, or regrow bone, but you have chronic inflammatory conditions, you've got a fire going on, you're kind of just bailing water out of a boat with like you're going to be working really hard and not getting the results you deserve. So while it's not fun to look at kind of a big thing that sounds overwhelming, it can be really empowering. And there's some people who get well in 6 months. Some people, it really depends on how many additional layers you've added on or how long this has been going on. So there's some people it takes 2 or 3 years. I'd say the average is maybe a year and a half, but it is worth it. And it doesn't need to consume your life. There are some hard decisions that have to be made. And sometimes that's related to cleaning your home, remediating your home, or even sometimes having to move like our family did. And that can be hard, especially like if you've got kids or a spouse and they don't really they're not super on board, and then it can become kind of a marital thing or a financial thing, right? But getting out of exposure is number one. And so if it turns out that you do have some mold in your house and it's likely not visible, most of us don't have mold crawling up our wall. We would do something about that. I'm not talking about that. I'm talking about something like maybe underneath the kitchen sink, underneath that bottom shelf. Maybe there was a little leak down there a couple years ago and it's since dried out, but maybe some mold is still present underneath that bottom shelf. And whether it's dead or alive.
I have to chime in because that's exactly my situation. So this was bad enough that they had to rip out the bottoms of the cabinets. But
That's
all
good.
along, I've had this faucet that sometimes leaks and sometimes a little
Yeah.
water comes out. No big deal. Unfortunately, nobody's gotten sick from it. However, when they came in, they said, "Oh, there's been mold here for years."
Yeah.
I was
Yeah.
shocked. I didn't realize that little bit of
Right.
water could have caused for years. It
Yeah.
didn't happen yesterday. They said, no, no, no. This is, and it had just been, every once in a while, the faucet would leak a little bit. We'd clean it up. No big deal. So yeah, I so
Yeah.
agree. And I've heard that story from
Yeah.
others. Well, yeah.
So if you do this screening tool, with the dust and it comes back, okay, you do have some elevations of mold and mold bits in your settled dust and in your air, then you'd want to get a really good inspector to figure out, where is this coming from? Let's identify all of the current and maybe even old issues, like water damage that has since dried, mold that's like dormant but maybe still present. That can still contribute to CIRS and be inflammatory. So somebody to go through your whole house like with a fine-tooth comb, figure out everything, and then come up with a plan. Okay, this needs to come out. This needs to be cleaned out. We're going to need to pull this carpet out. We need to redo the flooring here. Looks like we need to redo this bathroom. They're going to make some recommendations that are going to maybe be hard, to say yes to. But depending on how you're feeling and what your labs say and what maybe you and your doctor, you and your spouse or whoever decide is best, then yeah, going forward with that work and having your house properly remediated and properly cleaned afterwards to remove anything that might be just left over in the air and the dust. That is step one, getting rid of, stopping the ingress of new toxins that you breathe in. And then number two is to take a medication, a pharmaceutical binder that can bind to those toxins that your body's having a hard time getting rid of and pull them out through the stool. And so finding a binder that you tolerate well, improving your tolerance for effective binders is really helpful. And then you're on that medication for maybe several months. Lots of times once people are out of exposure and then they pull the toxins out of their body, it's like the pieces start to come back together. Your body wants to find homeostasis, right? And it's like other things start to fall into place. And if they don't, there are dietary interventions or supplements, that can kind of help some of our cytokines and our hormones find, that homeostasis again. And so the protocol that I'm trained in and that I followed personally is the Shoemaker protocol. And it's very systematic and evidence-based. You do one thing at a time. And basically, by the time you get to the top of the pyramid, you've put that jack back in the box and you feel great again. So again, some people have complicated conditions because they've been sick for a long time and they haven't known why. And that can take a little longer. Like if your body is used to feeling a certain way or certain dysregulations that have become normal, it can be hard to find homeostasis again. And so some people it takes 2 or 3 years, especially if you've got concussions or a lot of trauma, nervous system dysregulation, some mental health issues that are on top of, the mold exposure. It can take a little longer, but it's doable. Our whole family is beyond 100%. I think after you've gone through a chronic illness and you start to realize how valuable health is, you tend to it so much better. And so now our family, like we do all the things now that we took for granted before. And we have our health back. Now, my bone health, I need to figure out what's going on with that because that was recent. My inflammation is calmed down now. So I need to talk with you, Margie, about what I might be missing for my bone health, because now I'm kind of freaked out about, why is my bone health still, why is it in worse condition than I feel like it should be?
Because you've had this for quite a while.
Maybe because I had it. And I feel like, I'm 8 years well, but maybe it took its toll. I don't know. I'm going to watch it and I'm going to do all of the things that you recommend to support myself so that I can really rebuild, because I don't like what I'm seeing there. Yeah.
A couple questions. So it sounds to me, if you do have this issue, then you really should work with a practitioner because it's not a simple fix. But the good news is that there's hope and there's treatment.
Totally.
And you turn around and live a really healthy life, and your bones will also improve in the process. So
absolutely.
Such a win-win situation. So because I want you to tell everyone how people can work with you, and I know you have programs, so I want to share that. But you said a few things that I can't let pass by. You mentioned about bleach. And you said sometimes that actually makes it worse. Can you share your thought on that?
Yeah, well, mold is a living organism and it doesn't want to die. And so if it's stuck to a wall or say like the tile of your shower and you spray it, imagine a skunk in your driveway and you spraying it with a hose. It's going to fight back. It's going to spray you. Mold sitting on your tile in your shower is the same thing. It's a tiny little living thing and it sprays back at you and it sprays toxins. And remember, even if you don't have CIRS, even if you don't have the genetics and you don't have that whole thing, mycotoxins themselves favor bone resorption. So even if you're just spraying bleach in your shower and you inhale some of these mycotoxins, all invisible, and then they end up in your gut, causing leaky gut or just floating around in your bloodstream a little bit here and there, that is bad for our bones as well. So everybody, whether you have the genetics or not, we want to not anger mold. So we want to wipe it just with some soap. And if you actually see mold.
Okay. So there's black now in your shower, which is common. You see that all over us. You see a little bit of black. Okay. So what do we do?
So you want to first remove whatever is three-dimensional or topical, whatever's removable, right? And so just soap and water, a surfactant solution, just soap and water, maybe on here, like I got my handy cloth here, little dish soap and water or hand soap and water, and you're going to wipe first. So you want to remove anything that is removable. That's what's going to fight back if you were going to spray it. So you remove what's removable. Then if there's some staining or maybe some growth that's gotten into the grout or in where you can't really, it's not wipeable anymore, that's where you could use like some hydrogen peroxide. It's probably still not bleach. Hydrogen peroxide or vinegar is safer with a brush and try to brush it out. Sometimes we even need to just replace our grout if it's the grout or the caulk. Yeah.
That is just so helpful because, I think that's the typical, let's put some bleach. And when you said that, I know I have known that, but I don't think most people know that. So that was one question. The second question I had is, what do you recommend then with coffee and with a lot of our products? How do you recommend that we safeguard? Like, what should we look for?
Yeah.
We're not just ingesting mold through our food.
Yeah. Good question. So again, the things that I mentioned that start out moist and have to go through a drying process, for somebody who's really trying to eliminate mycotoxins, you would take out grains, nuts, chocolate, coffee, beer, tea, dried fruit. So I have some clients who are just taking all of that out of their diet. Anything that is prone to mold growth during the harvesting or kind of processing phase. That's kind of extreme for a lot of people. So we can look for brands that do third-party mycotoxin testing. Not all of those things have that yet, but coffee does. So there are several great brands of coffee that do test for mycotoxins. So I'm a coffee lover and I don't want to just have a sip of coffee and call it good. I want to have a couple of cups and know that I'm not ingesting mycotoxins every time. So Purity, Fabula, Dave Asprey's Coffee Bulletproof. There are a variety of
new ones, Danger.
Yeah, Danger. Yep.
And
there are a variety of brands out there.
Has a brand new one, a gut coffee. I think it's called Healthy Gut Coffee, which is also another mold one. So that's such a good point. Yeah.
I love it. Yeah. So usually they'll advertise that and you pay a little more for it. But in my opinion, it's worth it. And again, that's something that impacts everybody, not just if you have the genetics, but mycotoxins can mess with our gut and lead to chronic inflammation from leaky gut. So we don't want that. Anything we can do to mitigate that is going to decrease our inflammation and support bone health.
Those were the two big questions. So tell us what you offer, how people can work with you. There are programs, because I think that's exciting that, people can just learn more. Because I'm such a big believer, and this is just why I love bringing you on, because I like to dig deep and help people figure out what might be, because unfortunately in conventional medicine, this piece is missed and too many people are suffering unnecessarily. So when you can figure it out and then you can start taking action so that everything gets better, your bones, overall health, and, you're a happier person. So tell us what are options. I know you have a free program, actually, a free mini class people can.
I do. Yeah. And I'll give you that link that you can share with folks who are listening. It's a free mini course about CIRS. So if you want just enough information to kind of, dabble and see if maybe this relates to you, check out the free CIRS mini course that Margie will provide for us. If you do the free course and you're kind of thinking, I need to do a little more, I think this really is me. I have a longer course. It's a 12-module course for people who are pretty sure they have CIRS or have been diagnosed with CIRS. It's kind of like the patient's companion to their medical treatment. So their doctor's not going to explain everything along the way. And the doctor may not even explain how to clean the house. But I am trained in both the medical and the environmental aspects of this. I'm not a doctor, so I can't diagnose and prescribe. But I've created this course to really come alongside and empower patients to really understand their medical treatment, take care of their home properly, work on their mindset and their gut health and all the things to get all the way to the finish line. So that's called Equipped to Overcome CIRS. So that's a full course. But honestly, what a lot of people do, Margie, is they just book an hour session with me. And so I call this consulting. And so they can book like an hour consult with me and just say, okay, I heard your talk with Margie and I have a bunch of questions. And what was that website again? How do I do the screening? How do I order the dust sample? Or maybe they've done those things and now they just want somebody to review the results. And they don't want to make an appointment with a specialist quite yet because they're booked out by 4 months and it costs a lot of money. They want to make sure. So I love doing that, just explaining enough for people to understand and review their preliminary screening results with them and empower them with the right next steps, help them find a doctor who maybe is near them and well-trained. So I do a lot of connecting and kind of just coaching and consulting in this space as well. So that's what I do privately in addition to the course. I've got a community. I've got all kinds of things. People can go on my website and kind of see, some of the different features. But I think the mini course, the free mini course is probably a great next step for people. And then connecting with me one-on-one if they've got questions.
Oh, I love this. I'm so glad that you really explained it. And not that I want anybody to have this, but I really want to hear if anybody, and I'll share that with you, Jenny, too, if anybody, after you hear this, realize, oh my gosh, that's me. And, that's just the good news. And this is what there's always hope. And there's just so much that can be done so that you do not have to suffer like Jenny and her family did. But luckily, look at you. And then there's always a silver lining, right, Jenny? So now you wouldn't be what you're doing now and helping all these people had you not experienced that yourself.
Right. Yeah.
Is there anything before we end? This has been so wonderful. Is there anything that you want to share before we end?
No, not really. I guess just reiterating what you just said, that there is hope. While this might sound really confusing or different or overwhelming, it is, take some time to kind of, do your own research, let this sit, reach out to me. We'll spend some time one-on-one, but it really is worth it to dive into this and find out if this is a big contributing factor, because it can take so many symptoms off your plate. And by addressing the root cause of inflammation, we're preventing all kinds of things like Alzheimer's and diabetes and heart disease and osteoporosis. Inflammation is the root cause for so many things that we want to avoid. And this is a big one. So it's a rock to choose to look under, but it's an important rock. And I encourage you to do so if this is resonating with you. There is hope. So do it.
Well, thank you so much, Jenny. It's been a pleasure.
Thank you so much, Margie. It's been a pleasure visiting with you as well.
I hope you enjoyed my interview with Jenny. And if this sounds like you, please take action. There's a free screening test she talked about. She has a free mini course. So there's lots of resources to check out. And we certainly don't want to miss this as a root cause of bone loss. So thank you so much for tuning in. And I look forward to seeing you on the next episode.